In the insurance section, I will discuss the trends we are seeing in the market due to the Affordable Care Act, or simply termed the ACA. Then I will explain the benefits available through the Wellesley College Student Health Insurance Plan, while comparing it to the plans that are available on the government-run marketplaces. I will also list some common insurance issues that may occur during the academic year that could affect students' access to care while attending Wellesley College. Healthcare reform has reshaped health insurance plans by implementing minimum benefit requirements. A compliant insurance program must offer unlimited coverage for essential health benefits, coverage for pre-existing conditions, and 100% coverage for in-network preventative care. All good benefit requirements. However, these mandated benefits are costly and affect insurance premiums. In addition, employer-sponsored market trends include a shift to consumer-driven health plans that incorporate high deductibles and an increase in Health Maintenance Organization, or HMO, insurance plan offerings. This is worth noting because most HMOs typically provide a limited regional network of providers. HMO members are required to choose a primary care physician in the network. The primary care physician then is responsible for referring the member to other doctors or hospitals within the HMO network when needed. Generally, only emergency services are covered if the member goes outside of the plan's provider network. Plans offered on the government-run marketplaces are using similar cost containment strategies. The government-run marketplaces were established under the guidance of the ACA to make it easier for individuals to compare and purchase health insurance, as well as providing an online tool to apply for subsidies. In an effort to keep plans affordable, many include a high deductible and a limited provider network. Eligibility for subsidies is linked to an individual or family's tax return. If a student can be claimed as a dependent on their family's tax return, then eligibility for a subsidy will be based on their family's earned income level. To be eligible in a state that expanded Medicaid, including Massachusetts, earned income must be between 133% and 400% of the federal poverty level. That is between $33,465 and $95,400 for a family of 4. Or, in a state that has not expanded Medicaid, earned income must be between 100% and 400% of the federal poverty level. That is between $23,850 and $95,400 for a family of 4. Some students that permanently reside in states that have expanded may be newly eligible for Medicaid. Out-of-state Medicaid is generally not comparable to the Wellesley College Student Health Plan and does not meet the state of Massachusetts Student Health Plan requirements, which states that all students who are considered at least three-quarter full-time must have comprehensive health insurance that will cover them in the area of their college. In general, Medicaid programs provide very limited regional networks of providers that do not expand past state or even county lines. Wellesley's goals when designing their student health plan was to create an affordable plan with strong benefits that enable students to easily access care in the college area and that offers quality customer service to answer claim questions and assist students in navigating the healthcare system. The student health plan is insured by Blue Cross Blue Shield of Massachusetts. Blue Cross is committed to providing easy access to care for students and has established a special relationship with Wellesley College Health Service that allows students insured by the student health plan to receive medical services from the College Health Service at no cost. The College Health Service bills Blue Cross Blue Shield behind the scenes on behalf of the student. Under the student Blue Cross Blue Shield plan, students will find it easy to search for an in-network doctor outside of Wellesley College Health Service. The student health plan is a preferred provider organization, or PPO, providing students with access to Blue Cross Blue Shield's national network of providers that includes over 1 million providers and approximately 7,700 hospitals. The link to the network of providers can be found on universityhealthplans.com. The highlights of the student health plan include no deductible. A deductible is the amount a member owes for health care services before the health insurance begins to pay. No deductible allows students to receive necessary care without worrying about expensive medical bills prior to accessing care. The plan provides low copays for in-network services, including a $15 copay for office visits, $50 copay for emergency room visits, $25 copay for MRIs, and 100% coverage for lab work and hospitalizations. When comparing the student health plan to other health insurance options, the most important considerations are provider network, deductible, copays, and co-insurance. This shows a comparison of the Wellesley Student Health Plan to the individual plans offered on the Massachusetts Marketplace, known as the Health Connector to Massachusetts residents. The plans in the comparison were offered during the 2015 open enrollment period to a 21-year-old. The plans do not factor in premium or cost-sharing subsidies. The marketplace plans are labeled according to their value as platinum, gold, silver, and bronze. Platinum plans offer the strongest plan design at the most expensive premium. As you will see in the comparison, the student health plan is considered a platinum plan design offering an actuarial value of 90%. Actuarial value is the percentage of the expected covered expenses that a health insurer covers. We see that the Wellesley College Student Health Plan premium is very competitive compared to the plans offered on the Massachusetts marketplace. The 2015-2016 annual cost for the student health plan will be $2,004. All platinum plans offered through the Massachusetts marketplace are between $4,000 and $8,000 per year. The student health plan premium is even less than the lowest bronze plan in the state. You can see that the bronze plan includes a $2,000 deductible, $750 emergency room copay, $1,000 deductible for hospitalizations, and 50% co-insurance for brand name prescription drugs. You will see a benefit listed as OOP. OOP stands for out-of-pocket maximum. The OOP is the most money a member will pay out of pocket during the policy year. The OOP under healthcare reform is not allowed to be over $6,600 for in-network services. The Wellesley College OOP is only $2,000 for both in-network and out-of-network services. After the OOP is reached, then the plan will pay 100% of covered medical expenses. The copays and coinsurance are all very low on the Wellesley College plan. If you look at the comparison, you will see that most plans include high ER or emergency room copays and hospital copays. It is important that you take the time to look at the benefits of your current plan before deciding to opt out of the student health plan. The next slide lists common insurance issues that may arise due to a student's insurance decision. A student may find herself in an expensive dilemma when she realizes her family coverage is an out-of-area insurance plan that includes a limited network of providers. Those plans are usually health maintenance organizations referred to as HMOs or exclusive provider organizations referred to as EPOs. A few plans we consistently see cause issues for students in Massachusetts are Kaiser, Anthem, and Oxford due to their out-of-state provider networks and strict referral requirements. High deductible plans also tend to be problematic for a student. If the student is referred to a specialist or needs lab work, then she may not want to receive the services because she knows she will be responsible for the costs. High copays pose the same problem and may be more challenging for a student because copays are typically required prior to the medical service. Travel immunizations are oftentimes not covered by insurance plans. The Wellesley Student Health Plan covers travel immunizations according to CDC recommendations. CDC means Center for Disease Control. Students that are traveling abroad and need certain immunizations prior to departure may benefit from Student Health Plan. Additionally, the Wellesley Student Health Plan offers worldwide coverage with a network of hospitals abroad that a student can simply show her card to and have the bill automatically submitted by the provider to the insurance company. These are all reasons students need to be aware of their other health plan restrictions before waiving the Wellesley College Student Health Plan. The Student Health Plan premium is $2,004 for the 2015-2016 academic year. Coverage is effective for a full 12 months, August 15th, 2015 through August 14th, 2016. Students that have comparable coverage to the Wellesley Student Health Plan that meets healthcare reform requirements and provides coverage in the Wellesley and Greater Boston area can opt out of the Student Health Plan by completing the annual academic year 2015-2016 online waiver form. Benefit and waiver information will be sent to the student's Wellesley email address, advising students that the waiver form will be available on University Health Plan's website on June 2nd. The fee for the Student Health Plan will appear on the first e-bill or electronic bill for the fall semester sometime around the first week of July. Please note that the annual waiver form deadline date is July 29, 2015. And thank you so much for listening today.